Hi, this is Dr. Rafiullah speaking. Today I have got extraordinary mnemonic for memorizing the drug classification of congestive heart failure or congestive cardiac failure. Our mnemonic for remembering the antiarrhythmic drugs is 3 time A, B and 3 time D. So A, then B and then 3 time D. Very easy mnemonic. A, B and D. You have to remember just three letters of English alphabets. A, B and D. But their numbering is different. 3 time D and 3 time A and B in the middle. Now let's break this mnemonic and see that how A, B and D mnemonic represent the whole class of congestive heart failure drugs. A stand for ACE inhibitors. These drugs like enalapril, lisinopril work by inhibiting the angiotensin II converting enzyme. This action reduces blood pressure, making it easier for the heart to pump effectively. So oxygen demand is less for the heart. So the balance between oxygen consumption and oxygen demand will be managed, which is the major factor for controlling and managing congestive heart failure. And next, A represent aldosterone antagonist, including spironolactone and eplerenone. These drugs reduce the retention of sodium and water, which can be beneficial in managing congestive heart failure. By losing the sodium and water, we decrease the volume of blood and load on heart. So our heart need to be very little work doing. Next, A stand for ARBs, angiotensin II or angiotensin receptor blocker. Drugs like losartan and valsartan can be an alternative to ACE inhibitors, helping dilate blood vessels and reduce blood pressure. Now B represent beta blocker, including metoprolol, carvedilol and bisoprolol. These medications reduce the workload on the heart and improve its efficiency. Next we have D. Moving on to D for diuretics such as furosemide and hydrochlorothiazide. Diuretics help by increasing urine output, reducing fluid retention and relieving symptoms of congestions. Remember that furosemide is loop diuretics while hydrochlorothiazide is thiazide. Second D represent digoxins, a medication that enhance the force and efficiency of the heart's contraction, thereby helping managing congestive heart failure. Remember that digoxin and digitoxin are sodium potassium ATPase channel blocker. These medication increase the force of contraction of heart, enhancing the ability of heart to pump more blood and work more efficiently. Remember that digoxins have very narrow safety margins, so be careful while administering digoxins. The last D on our mnemonic direct renin inhibitors such as L-skyrines. These drugs target the renin-angiotensin system similarly to ACE inhibitors and ARBs. Now the bonus tip for remembering the different class of ACE inhibitor is that ACE inhibitors end with a common ending pril. So any drug ending with pril group will be our ACE inhibitors like lisinopril, captopril, furosemide and so on. Any drug ending with sartan like losartan, candesartan, valsartan will be angiotensin receptor blocker. Any drug ending with olal like metoprolol, bisoprolol, carvedilol will be beta blocker. So again our mnemonic is 3 time A, B and 3 time D. Just A, B, D, but their numbering is different. 3 time A and middle B and 3 time D. First A stand for ACE inhibitor. Second A stand for aldosterone antagonists. Third A stand for ARBs. B stand for beta blocker. D stand for diuretics. Second D for digoxin and digitoxins. And the last D is for direct renin inhibitors. So this is a very simple mnemonic to remember the difficult and volatile concept of congestive heart failure. If you learned something valuable from this video, please give a favor, like this video Subscribe this channel and share this video with your friends. Thank you so much.